If you're looking for a non-invasive therapy that has been shown to lower stress and anxiety and even help with severe trauma, this might be the therapy for you or your child. The great news is, this is a therapy I can say really helped me through lots of traumatic events in my life. Trauma isn't necessarily always something major like a car crash or abuse. It can be shame and embarrassment that you or an autistic child remembers that is upsetting every time thinking about it. One interesting thing that seems to be pretty common amongst us autistic individuals is we can obsess over a thought or a memory that was upsetting to us, such as a mean comment a teacher made or how another child purposely left us out at playtime. These kinds of things we do actually think about that we may not talk about. Even memories like the time I planned a fun gathering at my friend's house to meet her family. I followed the GPS, went inside the house, sat down on the couch and waited as she texted me earlier to have a seat while she finished getting ready. I chatted with her very nice elderly grandparents who were also in the living room, and my friend finally came down the stairs, only to realize that it wasn't my friend. It was a caregiver, to which those grandparents thought I was another caregiver without question. After much embarrassed laughing, we figured out my friend's address was actually next door. Fun times! In my case, as an adult, I tend to obsess over many embarrassing or shameful moments in my life that I replay over and over in my head. Things I wish I did differently, or things I wish never happened. And how EMDR comes into this is it desensitizes your feelings of the event you've been emotionally heightened about. Now, when thinking about the traumatic event, I don't feel the stressful emotion I once did. That's why I use this method on Raiden, who is mostly nonverbal, when he seems sad or angry about something going on in his head. This is where parents' observations really would be beneficial in helping a child process stress, anxiety, and trauma if the child is nonverbal. What is EMDR? Eye movement desensitization and processing. Don't let this acronym fool you. It's not necessarily only eye movement. Although it uses this method, there are other methods such as alternative tapping that you can choose to do during a session. Eye movement seems to reduce traumatic episodic memory and favor the reconsolidation of new associated information. EMDR is a structured therapy that has a patient briefly focus on a traumatic memory while simultaneously experiencing bilateral stimulation, which encourages better communication between the two sides of the brain. Something to note, this was mostly done on neurotypical children, so the different phases that is done during an EMDR session may be done differently for an autistic child. For Raiden or myself, I use the tapping method. When Raiden gets overly upset in a moment about something, I may not be able to walk him through each phase of a typical therapy session, but it seems to still be somewhat effective by just using the tapping method. I've included what an EMDR therapy looks like in one of my links below in the description. It is insane to think that something so simple can do so much for the brain, but it's clearly possible. Definitely do your research about this convenient therapy on ways to implement them with your autistic child, as many are nonverbal or non-communicative. I hope you found this an interesting and cool way to help your child deal with stressful experiences. Don't forget to like and subscribe. Looking forward to seeing you in the next one.